Thanks for staying with News at Prime. The last leg of the National Health Insurance Bill for Gauteng is being concluded in Germiston tonight. Yesterday, Sowetan's highlighted their daily struggles with public hospitals and clinics. Staff shortages, poor health infrastructure and financing of the NHI were just some of the issues raised by residents. Well, let's discuss this further. We're joined by Dr. Sibongiseni Dhlomo. He is the chairperson of the Portfolio Committee on Health. It's the final public hearing session that you're holding in Gauteng. I wonder, just generally, how has this process unfolded and what has been the reception that you and other MPs have received?
Good evening, ma'am, and good evening to all the viewers of Newsroom Africa. As you are correctly putting it, this is our last stop in a province called Gauteng and our very last stop at Germiston Town Hall today. We are still having the proceedings in place and listening to residents, talking to us, commenting. It's been a varied type of views coming in from the time we started in October until today. And those views are varied from the South Africans who are saying, we've heard about this NHI, we can't wait to see it being implemented. We thought we were coming to announce its implementations. Some of the South Africans who say, while we support the NHI, we do really make sure that the department deals with those challenges that some of them we have highlighted in our opening comments, issues of long queues in clinics and hospitals, challenges regarding the shortage of staff, of medicines, and debilitated infrastructure. Now we are saying, as we are doing these public hearings, the Department of Health is there with us listening and actually taking those concerns of our South Africans and probably having a plan how to deal with them.
President Cyril Ramaphosa, in one of his letters, has put out the year 2025 as being the targeted date for the national rollout of the NHI. That's just 5 years from now on. As far as budget goes, do you think that we have the kind of funds that are needed to fully resource the project?
Yes, you need to actually give a view. There is a 16% of South Africans, and I'm part of them, who are receiving a huge benefit from the government's fund, which is my medical aid is heavily subsidized, and my domestic worker, my gardener, and my neighbor is not part of that. It's firstly to rearrange this 25 billion that is allocated to the 16% of the population part of it, and they're having the other 84% of South Africans already having the same cake, same size of a cake as the 16%. Now that's an anomaly. So the starting point is rearrange the already existing funds and make sure that you can even top up from there. Now, this is not a program of a South Africa sitting out there. It's a global trend of a World Health Organization advocating for universal health coverage for citizens of the world. And in countries where this has taken place, there's been an economic boom, there's been an improving life expectancy of those countries, and then a lot of stability, social cohesion, social stability. So there are a lot of other benefits on that, but the starting point is we are actually delayed in terms of making sure that the health access is for all South Africans. By the way, if you may know, private healthcare sector also has got its own challenges. Study the report of Judge Dhlomo. Judge Dhlomo tells us that there are challenges there. So we want to move away collectively as South Africans from the notion that fix the public hospitals, everything will be ready and fine, leave the private hospitals alone. No, they must maybe all of us buy into this new slogan following the report of Judge Dhlomo that there are serious challenges both in the public and private healthcare sector. Maybe it is time that all of us now advocate for a new order, a new health system in the country.
The health sector in general receives about the second largest portion of the country's budget. What would the minister need to announce on Wednesday that shows a realignment and a redistribution of these funds, as you put it, to really show that there is a move from subsidizing the private sector and that money is now being channeled into the public sector?
It will not happen on this budget, because as we are still putting this NHI, as you are rightly putting it, the president is talking about 2025. That is, by that time, we should be seeing a lot of signs of NHI in the country. We need to be putting building blocks here and there, and you probably are aware that there was an NHI pilot site, pilots that were done, and we as a committee ourselves are awaiting the report of how that was actually done, because that report is going to be very helpful going forward as to what are the things that must be looked for, what are the challenges that were picked up, and how do we get them to move forward. So 2025-26 is not too far away, considering the amount of work that needs to be done. Of course, there are certain clinics, hospitals that will be ready as early as within 2 years, but we are saying within this next coming 4 or 5 years, all parts of our country should be able to get into the gear of universal health coverage.
Sure. And of course, there are some that have said that the health department in and of itself needs to start fixing some of the challenges around infrastructure and service delivery, which residents have been telling you about even before there is clarity on how exactly the NHI is going to be affected. The impression that one gets is that the experience of those who are using the public healthcare system doesn't seem to be improving.
We do not want to undermine the concerns of the South Africans. That is why, among other things, in this bill we propose that there should be registration. There are people, the movement, the mobility is such that that clinic, that hospital that was built 10, 15 years ago, or even 20 or more, has got a number of people who are now using that particular facility. The improvement of that facility, the expansion of that, and creating and building more other clinics. So all those things should be actually in the program. We do not want to run away from the real, true story of South Africans, that they're experiencing long queues, small clinics that they have, sometimes a shortage of medicines. That is what is contained in the Presidential Health Compact, which Dr. Mkhize and his whole department must look into, because those are things I could call pillars of NHI. It will not be able to, we won't be able to get NHI getting off the ground until and unless these things are really addressed. So, but there's a belief that fix these things as we go along. You can't say there's a long rope of fixing this. Only then, many countries that have gone this route started when their economies were at a crisis. One of those is Japan and United Kingdom. So it's not possible and fair to say, let's wait until all these other things are addressed. Only then we consider universal health coverage.
Of course, Parliament is going to be a crucial role, especially when it comes to not just matters of oversight, but also in providing clarity around how some of the things which have faced quite a bit of contestation, like the NHI fund, and how that is going to be administrated are concerned. So how do you see your job as a key stakeholder on this particular matter going forward? And I imagine also trying to bring all the stakeholders together and getting some kind of consensus, even with those who've already promised litigation.
The ownership of this bill is the Department of, with the Department of Health. We are there to support and do oversight. We have been listening to South Africans, and this is our last day today, but there are other South Africans, various institutions, stakeholders who want to come and make presentations to us in Cape Town. We also have to take care of that. But a lot of answers as to this NHI, how it's going to go about, the enablers of that will be answers that the minister and the department must provide. But not only the minister, even the private sector, because as you are pointing out, challenges are across the board, both in the private and public. So some of the private healthcare sector must also reconfigure themselves to be ready for NHI, much as the public healthcare sector must do the same. So we are doing oversight, getting to listen and see challenges and then bring it to the attention of the minister or ask the minister, what is your take on the following challenges that we see in the country? How do we accelerate these enablers, these presidential health compact programs that you need to address to enable NHI to kick off in a very good way?
All right, Dr. Sibongiseni Dhlomo, let me thank you for your time. Of course, he's in the midst of those hearings, so appreciate your time tonight. They're taking place in Ekurhuleni on Gauteng's East Rand.